Good morning, students. This is Dr. Santoni checking in on the end of Module 1. I'm getting through your exam. Some of you will have grades from me already, and if you don't have them already, they will be there this evening when I get home from McDaniel. Just a couple of things. Sorry, I'm looking over here at some of the exams and can't see both things at the same time. But just a little general feedback from Module 1. A lot of you described that your greatest obstacle with the biometric screen was the skin fold measurement. I did have 2 students come in and work with me on skin fold, and quite a few come in and work with me on blood pressure. Please, even if you're not accessible to McDaniel, part of being a personal trainer, one of the fundamental components of being a personal trainer really is feeling comfortable and confident executing these tests. What I can tell you for absolute certain is that your ability to execute these tests with the confidence and comfort that you need to be able to has to do with practice. So please feel free to make an appointment to come in and see me. We can practice in my office. And if you are not accessible to McDaniel, we can always set up a Skype. I can find a local resource for you. But the two, and I would agree with this, that the two kind of largest obstacles are definitely blood pressure and definitely skin fold. So just to give you an idea, if you were to go to become a registered clinical exercise physiologist, and I think with CSCS, you have to have a certain amount of hours practicing those 2 tests because they are so difficult to execute consistently. A lot of you talked about motivation for the tests. That's always going to be an obstacle, which is why in this section we really did talk about behavior change and exercise adherence. And just remember to reinforce the purpose of the tests you're taking and how they're related to the goals of the person that you're taking them for. Okay, so in terms of identifying circumstances when you would terminate a test, this is really simple. There are 2 tests, two, that you should always take with everyone universally. Those are resting heart rate, and those are blood pressure. Resting heart rate, if normal resting heart rate is 60 to 80 beats per minute, and any resting heart rate over 100 beats per minute or anything irregular would be cause to terminate a test or to not continue with your assessment. That is 100% always true. And then with blood pressure, normal blood pressure is 120 over 80, and anything that's hypertensive, 140 over 90, in an individual that isn't aware that they have blood pressure and it hasn't already been cleared, would require medical clearance for them to continue exercise. That's fairly important as well. For people with uncontrolled hypertension, elevating the heart rate or the preload on the heart by doing a bench press or lifting a weight can cause a heart attack. So those are the 2 that are really red flags and a reason not to continue. Some of you identified things in the environment like temperatures that were too hot, and of course you must always exercise caution in those environments, but the 2 never proceed are the heart rate and the blood pressure. I got a lot of different answers for tests for weight loss. Please remember that skin fold, while it's extremely valuable, skin fold measurements are more often taken when we're trying to maintain lean mass. So while somebody who's losing weight might change their diet, it's really unlikely that they're going to lose a lot of muscle mass unless they go on an extremely restrictive diet. So unless you're concerned about that, then that would not be the best answer. Not a bad answer, but Really here, we're looking at girth. Some of you said DEXA scan. Weight is a measure. You could talk to them about clothing size, which is another way to talk about girth. But again, lots of answers here. If you need any additional clarity on the skin fold question, please give me a call or send me an email, and we can take care of that right away. Running a marathon, most of you nailed this. We're really looking at the functional capacity test. Some of you discussed heart rates at different intensity levels, also a great idea. This overall was a very good. I was pleased with the answers to this question. And then somebody looking to gain muscle mass. This one, girth measurements. You may want to do body fat here if you're concerned about someone who's like, taking on, you don't want them to be gaining fat, you want them to be gaining lean. So this might be an area where you would consider doing skin fold measurements. But again, good answers all around. I was pleased with all of your performance on this module's exam. And question 6 is just that the forms that I asked you to hand in as part of your discussion board, we are going to be coming back to those for your project in module 3. So I just want to make sure that they're ready. So there is an additional grade associated with those. I'm going to just post this video in terms of a wrap up of module 1. Big take home points here. Practice, practice, practice. If you need more of that practice, please give me a call and let's set up that time. There was one other thing. BMI. Please remember that body mass index is fairly inaccurate with athletes. That for someone who, like a football player who has a lot of lean mass, it will overpredict and it will say that they're obese when really that's not the case. They just have a lot of lean mass. So that would be not the best candidate to use that measurement for. So sorry, put that one out there too. So again, main take home points, practice, call me, get this under your belt. It's a critical component for personal training. And a good job on this exam. Skin fold measurements, not really for weight loss. You could, but it's not going to be your best choice. Really here you're looking at girth or size loss. But overall, really good job in this module. Looking forward to module 2. I'm going to post an intro to module 2 right after I post this video. Thank you all very much. And if you need anything, as always, give me a call. Thanks. Bye.